Nodules are small, liquid-filled bumps that can grow throughout your body. They can grow anywhere, but they're most common in your throat, thyroid, lungs, and adrenal glands. This might sound alarming, but don't worry. Nodules are very common and almost all cases are benign. In most cases, your doctor probably won't even try to treat them. However, natural home remedies have mixed success in shrinking nodules. If you do notice any growths on your body, then see your doctor for an exam. They can confirm whether or not you need treatment and recommend the best course of action for your health. So, we are going to watch about the how to dissolve nodules. Can natural remedies help?
Method 1. Treating nodules at home.
First is observe the nodule to make sure it doesn't grow. The watchful waiting procedure is the most common approach for benign nodules. No matter where they are, your doctor will observe the nodule for a 6 to 18-month period to see if it grows or changes. If not, then the doctor will probably leave the nodule alone with no further treatment. Stay in contact with your doctor during the watching period. If you notice the nodule growing or changing in shape, schedule an exam. Step 2. Try an herbal mixture to shrink benign thyroid nodules. While home remedies don't have much effect on nodules, one natural treatment might help for thyroid nodules. Try a mixture of 400 mg of spirulina, 50 mg of curcumin, and 50 mg of boswellia twice a day. This treatment showed some success in shrinking thyroid nodules after 3 months. Ask your doctor before trying any herbal treatments like this to make sure it's safe for you. Step 3. Avoid using Chinese herbal medicine as a treatment for nodules. While some websites claim that mixtures from Chinese herbal medicine are an effective nodule treatment, studies don't prove this. There is no information confirming that these treatments work on nodules. So skip them unless your doctor recommends them.
Finally, don't try to treat nodules with dietary changes.
Some websites claim that eating more fruit, yogurt, and dietary supplements while cutting out fatty foods will shrink nodules. These are mostly good dietary tips, but they won't shrink your nodules. So don't rely on this as a treatment. Following a good diet high in fruits and vegetables does lower your risk of cancer, particularly thyroid cancer. However, this still won't shrink your nodules.
Method 2. Medical treatments for nodules.
First is have a biopsy to confirm that the nodule is benign. While it's very rare, there's a small chance that a growth on your body could be cancerous. Whenever your doctor examines a nodule, they will probably want to do a biopsy to confirm that the growth isn't cancerous. During a biopsy, the doctor will take a small sample from the nodule and test it for cancer cells. In most cases, this comes back negative and confirms that the nodule is benign. The biopsy procedure might be different depending on where the nodule is. For a thyroid nodule, the doctor may insert the small needle into your neck. For a lung nodule, they may insert the small tube down your throat. Biopsies are standard medical procedures, and having one done doesn't mean that you have cancer. Over 90% of nodules are benign and non-cancerous, so the biopsy is just a precaution. Step 2. Take hormone medications if the nodule is on your thyroid. Both an over and underactive thyroid could cause nodules on that gland. If you have either condition, then your doctor may want to try regulating your thyroid with hormone medications. This might shrink the nodules and correct any other complications. If you have an underactive thyroid, the doctor will probably prescribe synthetic thyroid hormones to boost your thyroid function. If you have an overactive thyroid, the doctor may prescribe an anti-thyroid medication like tapazole to reduce thyroid function. All of these medications are powerful, so take them exactly as your doctor directs you to.
Step 3. Correct adrenal nodules with hormone medications.
Nodules on your adrenal glands would interfere with your body's hormone levels. If your doctor discovers that your adrenal hormones are off balance, then they'll probably prescribe some hormone medication to regulate your adrenal function. Step 4. Leave lung nodules alone if they aren't causing any problems. Nodules in your lung, as long as they aren't cancerous, usually don't cause any problems. You probably won't even notice they're there, and doctors usually discover them during routine CT scans. It's best to leave these nodules alone and simply observe them to see if they grow. If nodules cause any breathing trouble, then your doctor will probably suggest a surgical removal.
Step 5. Shrink cancerous nodules with alcohol injections.
This treatment, called alcohol ablation, is a potential treatment for small cancerous nodules. The doctor will inject a small amount of alcohol into the nodule to kill any cancer cells. This might help you avoid surgery for smaller nodules. Alcohol ablation requires several treatment sessions, so make sure you stick with the recommended schedule for the best results.
Finally, remove large or cancerous nodule with surgery.
If the nodule is causing problems or is cancerous, then the doctor will probably want it surgically removed. This is often a simple, minimally invasive surgery, depending on where the nodule is. By removing the nodule, you should avoid any risk of it spreading. After the surgery, you may need further cancer treatment. If you have a nodule on your thyroid removed, the surgeon may also take out part of the thyroid. In this case, you might have to take thyroid medication afterward.
Method 3. Soothing throat nodules. First is drink plenty of water.
While drinking water is always important, it's especially important if you have throat nodules. This can keep your throat moist and prevent damage. It can also soothe your vocal cords if you've been talking a lot.
Step 2. Limit your alcohol and caffeine intake.
Both of these can irritate your throat and make nodules worse. Drink caffeine and alcohol in moderation so you don't aggravate your symptoms.
Step 3. Quit smoking or don't start at all.
Smoking irritates your throat and can cause nodules if you smoke. It's best to quit as soon as possible. If you don't, then don't start in the first place. Secondhand smoke can also cause throat problems. Don't let anyone smoke in your home and excuse yourself from smoky areas. Finally, treat any underlying health issues you have that could cause nodules. You might not expect it, but some health issues can put you at a higher risk for developing nodules in your throat. Talk to your doctor and follow the treatment regimen that they prescribe for you. Common conditions that could cause nodules include allergies, acid reflux, sinus infections, and hyperthyroidism. Some of these conditions might have natural treatments, and some might require medication. For example, if you have acid reflux, then avoiding trigger foods could help, but antacids might be a better treatment. Always follow your doctor's suggestions for the best treatment.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.